Welcome to the Idea Exchange podcast. In today's episode, we are talking more about deafness. I'm your host, Wes Piri, and our guest is.
Vincent Chilemba.
Welcome.
Thank you.
What is deafness?
So deafness, also referred to as hearing loss, is when an individual is not able to hear properly. So this is the inability to understand speech in a normal conversation level. So these individuals will not be able to understand or to be aware of speech and a normal conversational level. They might be able to be aware or to be made aware of speech when it's louder for some individuals. Whereas for other individuals, it's complete with complete deafness. They cannot perceive any sound, no matter how loud it can be.
What are the different types of deafness?
So we have three major types of deafness. That's conductive hearing loss or conductive deafness, sensory neural deafness, and mixed deafness. We have a fourth category, which is not really uh, uh, a problem with the auditory system. It's called non-organic hearing loss. So conductive deafness or conductive hearing loss is when the sound waves are not being transmitted from the outside to the sensory components of the inner ear. Sensory neural hearing loss is when the sound can be transmitted from the outside to the inner ear component or the sensory component of the ear, but an impulse cannot be generated or cannot be conducted to the brain. Mixed hearing loss is when you have both conductive and sensory neural hearing loss. As for non-organic hearing loss, this is when someone who is supposed to be hearing chooses to present themselves as not being able to hear. It can be due to mental health conditions, or maybe it can be deliberate to defraud uh, the hospital systems, to defraud insurance, or to defraud their employers.
How common is deafness and which population are most affected?
So currently, there hasn't been major researches to quantify the cases of deafness here in Malawi, but a community-based study done in 2019 found a prevalence of around 11%. That is among children aged 4 and 6. So from this study, we can see that uh, deafness is common, and some people can be susceptible to hearing loss, but not necessarily death, and they might not even know it. They might live normal life with reduced healing abilities.
What are the primary causes of deafness?
So the primary causes of deafness or hearing loss are prenatal causes. So these are causes that happen to a baby before they're born. So this can be ototoxicity, toxoplasmosis, or cytomegaloviral infections. Or the other causes can be perinatal. So these are causes around the birth of a child. So this can be uh, trauma, hypoxia, and prematurity. So this is when a baby is born when they're not mature. They can be susceptible to deafness or hearing loss. Other causes can be postnatal. So these are causes that happen or that take place after someone is born, and these causes can be genetic. For the genetic causes, so we're looking at syndromes that affect the auditory system. For example, Usher and Penrod syndrome. Other postnatal causes of hearing loss can be non-genetic, like ototoxicity. So this can be exposure to drugs or other substances that affect healing ability, or infections like mumps. And there are also other causes like lodging of foreign bodies in the ear canal, wax impaction. So when there is accumulation of wax in the external ear canal, otitis media with effusion. So this is a middle ear infection, and this is a complicated infection with production of pus. Deformed pinna. So the pinna is the outer ear, the earlobe. So when the pinna is deformed, there can be reduced hearing. Perforated eardrum. So this is when the eardrum is damaged, maybe by uh, increased pressure in the middle ear, or by accidentally when someone tries to put something inside the ear. And also otosclerosis. So this is a condition that affects the bones inside the ear that help to conduct sound to the innermost ear.
How does deafness impact the quality of life and overall health?
So for the most part, a deaf person or someone who cannot hear properly, they have and they have negative impact on the quality of life. They might be excluded from other activities, from other social activities. They might be predisposed. Excuse. They might be predisposed to psychosocial complications like anxiety, depression, and loneliness. Uh, they might also have uh, they might also experience complication of the infection, the specific infection that is causing the deafness. So this will impact the overall health. And in cases where the auditory deficit has been caused by a genetic syndrome, they might have other presentations. They might have other impacts on other systems due to the genetic syndrome.
What are the most significant risk factors for developing deafness?
So the most important risk factors would be exposure. So this would be exposure to ototoxins or infections that can complicate or that can cause hearing loss. Genetics. So this is specific for the different types of syndromes that present with hearing loss. Uh, Also complicated birth. So when someone is underweight, or not necessarily underweight, when someone is premature or there's been trauma during the birthing process.
How do genetic factors contribute to deafness?
So genetic factors would contribute to deafness by defects and syndromes. So defects are developmental anomalies that can happen when when a baby is being formed in the womb. So they might have defects affecting the ear and the auditory system. Syndromes are a collection of symptoms that are that are that affect an individual, and they have a genetic predisposition. So some individuals are more likely to develop a particular syndrome than others.
What role do environment factors play in deafness risk?
So the most common and the most important environmental factors that play a role in deafness risk are exposure to loud noises and ototoxicity. So loud noises directly damage someone's hearing. So when someone works in a loud environment or lives in a polluted city, they might be predisposed to developing a hearing loss. and also exposure to ototoxicity or ototoxins. So these can be drugs or other substances that can be deposited in the body and directly affect someone's ability to hear.
Are there any preventable causes of deafness?
So yeah, there are preventable causes of deafness like noise exposure. So reducing noise exposure can prevent deafness. Infections. Most infections that can complicate to deafness can be prevented. Also, perinatal complications like trauma or maybe premature birth and other complications associated with the birthing process can be avoided by implementing better birthing techniques and technologies.
What are the early warning signs of deafness?
So the early warning signs of deafness would be reduced ability to understand normal conversations, and this is easy in older individuals who can express themselves, but it can be hard in children. So for children, uh, the earliest you can detect deafness or impaired hearing abilities is when they are a bit older or when they are growing and you have noticed that they're not responding to uh, to auditory auditory commands or auditory clues.
Used.
So we have different tests that can be used in the audiology department to diagnose deafness, and these tests basically they just quantify the ability of an individual to hear specific frequencies. So they will show or they will try to find the lowest decibel level someone can hear of a particular frequency, and the frequencies and the decibels are plotted in a chart and analyzed.
What are the difference between mild, moderate, and severe deafness?
So the different types of deafness can be differentiated by the ability of that particular individual to pick up uh, specific levels of sound, like specific volumes of sound measured in decibels. So for a normal person, uh, they might be able to pick uh, sound uh, below a negative or below 25 decibels to like below 0 up to negative 10. But for someone who is deaf or they have moderate deafness, they cannot be able to pick uh, uh, any sound below 25. Also, they'll only be able to pick sound above 25. And someone who is moderately deaf, they might only be able to pick up sound maybe above 35 or above 40 going up, and nothing, and they might not be able to pick any sound below 40. And someone who is severely deaf or maybe they have severe deafness, they might only be able to pick up sound above around 60 decibels. So any sound lower than 60 decibels, they might not be able to pick it up. So it comes to the loudness of the sound. So someone who is severely deaf, they will need a very loud sound for them to be able to pick it up.
What are the common misdiagnoses or complications of deafness?
So the most common misdiagnosis can be missing the specific underlying cause. So maybe there is an infection or maybe there's been trauma. So you can clearly diagnose the patient as being deaf or as being as being affected like auditory impaired, but to come to a conclusion of this is the exact cause to pinpoint it can be challenging, and there might be misdiagnosis in the process of trying to pinpoint the specific cause.
What are the most effective treatments for deafness?
So an effective treatment would be different in different cases, depending on the specific cause of the deafness. For example, someone who has had buildup of wax, or they have had a foreign object lodged in the ear canal. The most effective treatment would be removing the wax on or removing the object. For someone who has had conductive hearing loss, the most appropriate form of treatment can be using hearing aids. So this can be uh, they're placed over the ears, or they can be placed on the bone, like the facial bones, to help with bone conduction. They can also do cochlear implants for people who are not able to pick up, who are not able to sense the sound due to an impairment in the cochlea. You can also teach individuals how to communicate despite having the hearing loss. If the hearing loss cannot be treated, by teaching them sign language and teaching them on how to read lips when someone else is talking.
How does speech therapy impact communication skills?
Speech therapy can help individuals who are deaf to be able to speak, or to be able to improve their speech. So they are particularly important in individuals who have been deaf from childhood. So these individuals they might have troubles in speaking. So speech therapy can help them to be able to speak or articulate words better.
What role do assistive listening devices play in a daily life?
Now, so with assistive listening devices, an individual who has a hearing impairment can be able to regain normal function, and they can be able to live a normal daily life. It can greatly improve quality of life and can introduce the particular person to different opportunities which they could have never had if they did not get the healing assistive device.
How do you manage deafness in patients with underlying medical conditions?
So in case of deafness caused by ototoxicity, in these particular individuals, any treatment that might involve an ototoxic drug must be considered, and the risk and benefits should be weighed appropriately. And in individuals who have reduced immunity due to a disease process, they can be given prophylactic treatment to reduce the risk of developing infections that can cause uh, hearing loss.
What are the benefits and risks of different treatment options?
So the different treatment options they have specific risks and benefits. For example, removing wax and foreign bodies. For the benefit for this is relatively cheap and easy, so it can easily be done in most settings, and it's easy. The least can be damage to the eardrum if there is no proper technique used. Use of hearing aids can greatly improve someone's hearing ability, so that's for the benefit. On the other hand, uh, they are really expensive and they cannot be accessible to most. Sign language and lip reading, the benefit is that they can they are relatively cheap, but on the other hand, they are hard to get hold of, so they might take time for someone to be able to be comfortable with them. Cochlear transplant, they are beneficial as in a sense that they can restore healing in individuals who could not hear, they can bring back the ability to be able to hear it again. But on the other side, on the other hand, they are really expensive as well, as the same as hearing aids, or even more expensive. And because it is a surgical procedure, it can get complicated and can come with other complications.
What communication strategies can individuals with deafness use?
So individuals with deafness can use sign language to communicate to others, or they can also do lip reading to understand when other people speak. They can also write down what they want to say and read out read, and lead uh, something that has been written to them by someone who is trying to communicate to them.
How do you counsel patients on communication techniques?
So, firstly, you encourage them to be patient, as this might take a really long time to get hold of, and to help them in managing their frustration. Uh, so, it's common to have patients who are trying to learn uh, communication strategies, being frustrated because of the difficulty, or maybe the progress of such uh, strategies.
What role do sign language interpreters play in healthcare settings?
So sign language interpreters can help uh, uh, people who cannot speak to be able to access a better care. So the sign language interpreters will interpret what the patient is saying to the doctor, and interpret what the doctor is saying to the patient, and make sure that there is proper communication between the two, and in turn making sure that there is proper care provided.
How can technology facilitate communication?
So technology can be used to have cheaper and more automated interpretations. So technology can be used to interpret sign language to speech, and can also be used to interpret speech to sign language. So this can eliminate the need for physical or to the need for personal interpreters, which can be expensive and can be inconvenient.
What are the challenges in communicating with patients with deafness?
So the challenges faced when trying to communicate with a person with deafness is, firstly, not knowing or not being aware that the person is deaf in the first place. So for the most part, when someone is deaf, or when someone cannot hear properly, they might appear normal. So you might try to approach them as you would approach a normal person. So it can be hard to really get to know that the person cannot understand you, and after that, after realizing that, it can be hard to now initiate a convo with that particular person if you do not have any skills on how to do sign language. Also, socializing with these particular individuals can be hard. So people might want to get along with these individuals, but maybe they do not have skills like sign language interpretation, or maybe doing the sign language themselves.
How do you support patients with deafness in daily life?
So the patients can be taught on how to lead or do or communicate using sign language. They can be taught on how to lead lips when someone else is talking to them. They can be taught reading and writing, and they can also be given access, or they can be directed to access to donor aid that can be provided to cover for uh, medical expenses that can be so expensive.
What role do support groups play in coping with deafness?
So support groups are groups of individuals that help people with deafness and other physical impairments to get treatment, to get a social life, or to improve their social and economic life. So they can teach them coping strategies. They can help them navigate systems like healthcare systems, education systems, and other systems like maybe also financial systems. They can help them develop social connections with other members, or even people outside the social group. They can also be uh, given access to charitable organizations that can help in their medical care or any surgical interventions.
How can family members and caregivers assist individuals with deafness?
They can learn to communicate with the individual by maybe learning how to do sign language themselves. They should spend time with them. They should also encourage them to pursue their dreams, to pursue their daily activities.
Deafness.
So there might be special need facilities. So these are specific facilities set up for people with special needs, and they might include people who have hearing impairment. They might have special need education facilities. So these are specific education opportunities that are reserved for to people with special needs. So these might include people with hearing disabilities. They might be eligible to charitable organization memberships and scholarships.
What challenges do you face in managing deafness cases?
So the biggest challenge is communication barriers. So most facilities they do not have an interpreter, so they cannot be able to treat someone who is deaf properly because there is a breakdown of communication between the patient and the physician.
How do you communicate with patients and families about deafness?
So to communicate with a patient about deafness, the first thing is to make sure that you can initiate a conversation in the first place. So by you should make sure that there is an interpreter which can link, which can translate between the two of you, and they reach a mutual understanding and help them understand the management strategies and plan together on the management plans.
What advice would you give to healthcare providers treating deafness patients?
I would encourage them to keep up the good work. They should also try to put in effort in finding charitable organizations that can help to cover expenses in people for people who cannot cover for themselves. They should also uh, find ways to make treatment for or treatment and care for these individuals cheaper. Maybe finding second-hand assistive devices like Haley aids, or maybe subsidizing the care, or forming policies that allow for subsidies to be offered for such individuals.
Thanks for your time.
Thank you.